Bismillahirrahmanirrahim. Today we will talk about the reactive arthritis. Reactive arthritis is one of the spondyloarthropathies, and it is a seronegative arthritis. And we know that seronegative arthritis means rheumatoid factor will be negative and ANA will be negative. Reactive arthritis is HLA-B27 positive condition. Reactive arthritis is not an infective arthritis, but it is actually an inflammatory arthritis. So it is post-infective inflammatory arthritis, not an infective arthritis. Reactive arthritis develops 4 to 6 weeks after some urethral infection or infective diarrhea. It is a type of arthritis in which the organism cannot be recovered from the joint fluid. Means the joint fluid will be sterile. There will be no organism in the joint fluid. The most common joint involved by the reactive arthritis is the knee joint, but it can also involve the spine, sacroiliac joint and other joints. It involves the joint in oligoarticular asymmetrical pattern. Reactive arthritis develops from two types of infection. It can develop from the SARA, that is sexually acquired reactive arthritis, and the organism responsible for the sexually acquired reactive arthritis is the chlamydia. And it can also develop from the infective diarrhea. And the organism which is responsible for the reactive arthritis after diarrheal illness are the Salmonella, Shigella, Yersinia, and Campylobacter. Reactive arthritis was previously called as the Reiter syndrome. And Reiter syndrome is a triad of conjunctivitis, urethritis, and arthritis. Due to conjunctivitis means pain in the eye, the patient can't see, and due to urethritis means dysuria, the patient can't pee, and due to arthritis of the knee, the patient can't bend the knee. So this is to easily remember the triad of Reiter syndrome: can't see, can't pee, and can't bend the knee due to conjunctivitis, urethritis, and arthritis. Reiter syndrome or reactive arthritis also can cause skin lesion like Sarsenet balanitis, that is painless papule at the coronal margin of prepuce, means at the gland finis, and keratoderma blennorrhagica, which is waxy brown papule or rashes on the palm and sole. Now, if a patient presents with the arthritis, urethritis, and conjunctivitis, we may suspect that the patient may have the reactive arthritis. So, how to investigate a patient with the reactive arthritis? Now, as we know that reactive arthritis is an inflammatory arthritis. So, if we do the inflammatory marker, that will be raised, like ESR and CRP, this will be raised. And as we know that reactive arthritis is a seronegative arthritis. So if we do the rheumatoid factor, this will be negative, and if we do the ANA, this will be negative. This rheumatoid factor and ANA is also done to exclude the rheumatoid arthritis and this SLE, because rheumatoid arthritis and SLE can also cause skin rashes. It can cause conjunctivitis, and it can also cause the arthritis. So to exclude the rheumatoid arthritis and SLE, we have to do rheumatoid factor and the ANA. We can also do imaging of the joint which is involved, like X-ray of the knee joint or X-ray of the sacroiliac joint or any other joint. And as we know that this is not an infective arthritis, so if you take fluid from the joint, there will be no organism. The fluid will be sterile. And we also know that reactive arthritis is HLA-B27 positive condition. It is positive in 50 to 80% of the cases of reactive arthritis. We can also do culture for urine and also do culture of the uh, stool to look for the active organism. Now, what is the treatment of reactive arthritis? First line treatment is NSAID. If the patient is not responding to NSAIDs, then we can start the DMARDs like synthetic DMARD like sulfasalazine or methotrexate. And if not responding to the synthetic DMARD, then we can start the biological DMARD like anti-TNF, etanercept. Now, what is the complication of reactive arthritis? Due to chronic urethral inflammation, it can cause urethral stricture, it can cause cataract, and it can cause aortic root necrosis. This was a video about the reactive arthritis or Reiter syndrome. In the next video, we will talk about the psoriatic arthritis. Thanks.